Hi, as part of our Staying Safe While Staying Home series, Maurice and I are going to talk about how we talk about drug use. Right now it feels important to give this topic some airtime because while we are staying home more and feeling more isolated, we know that it can be a time of increased risk of experiencing harm from drugs. And so where drug use may be increasing for a range of reasons, it is important to keep the conversations going.
But talking about this can be hard. Many people in our community experience discrimination because of their substance use. Many people feel their own sense of shame or embarrassment talking about drugs. And if the topic is off the table and there is also increased use, then the damage that can potentially happen can be increased.
So what are some guidelines for talking about this topic? First of all, the language we use is really important. Think about some of the language we may have heard in the media, especially in terms of people who use drugs. Many of these descriptions only reinforce negative ideas about people who use drugs, and for people themselves, it reinforces a negative self-image. Think about the difference between a term like drug user and changing that to a person who uses drugs. They are no longer defined only by their drug use. We can begin to see the bigger picture about that person and what is happening in their life, not only their substance use. We'd like to suggest that more neutral or positive language can be powerful in reducing stigma and removing barriers for getting help. This is one key step for how we can talk about this topic and how we see people and the labels we may use or can choose to avoid.
The second key thing is the idea of being able to start talking with a family member or a friend if you have any worries about your own drug use. Again, stigma and embarrassment can get in the way. So what if you've been prescribed some pain medicine by your doctor, but you weren't really sure about the directions given by the pharmacist, and you notice some unusual symptoms? Or maybe drinking alcohol as well, and you're not sure if it's okay to drink alcohol while taking the meds. If you're feeling worried or unsure, that can be a barrier to asking for help. So what would it look like to talk to someone? A family member perhaps? Or could you pick up the phone and speak to a pharmacist or your GP?
What about someone that you care about? If you have noticed that they're not travelling so well, and you're wondering whether their substance use might be part of the issue, what steps could you take? The most important step in doing this is to ask permission. And by asking the question, it is a way that you can show respect and care for that person.
For more detailed steps on talking to a loved one, check out these links here, including this How to Talk to a Loved One brochure. And we also have this clip, which will step you through how to talk about drug use with a loved one.
So, talking about drugs can be a tricky topic. But thinking about how we talk about drugs and how we talk with people about our drug use or another's drug use is a way to break down barriers, find or offer support, and learn where to find good information.
And remember to keep this topic on the table while you're staying safe while staying at home.